since your nurse, I know you're about to get discharged today, but I wanted to see if it's a good time to discuss your new medication you be taking home, the Cefalozin. Is this a good time right now?
Yes, Miss Ariel.
Okay, perfect. First things first, how do you learn best? Do you like pictures or like documents?
Documents.
Documents, perfect. I created one for you so we can follow along
Thank
and
you.
we'll go over it together.
Yes.
So with this medication, it's called Cefalozin. It's known as its brand Ncef and Cefazolin. And with Cefalozin, it is used to treat bacterial infections as it works by weakening the bacterial cell wall and ultimately leading to death of the bacteria. With this medication, you'll be taking Cefalozin either orally or through intramuscular injection. With intramuscular injection is either the deltoid or the thigh, but I understand you don't like taking shots, so we're doing the oral route. This should be taken with an empty stomach about 1 hour before a meal, and to remember to finish the entire course of the medication, even if you start to feel better. With this, we'll also set up an appointment with your healthcare provider to order labs work to monitor your renal function to reduce any potential side effects. So, on the topic of side effects, we need to be aware of the Cefalozin. It can cause ototoxicity, which can affect your hearing as well as your balance, and nephrotoxicity, which may harm your kidneys. That's what we're going to do the lab work to make sure everything's okay for that part. If you had any renal impairment or hearing impairment, we would withhold this medication, but prior to this, we've already established that you don't have those problems, so that's where you're going to be taking this medication. We've also went through the topic of your allergies, and you don't have any allergies to penicillin, so that's great. Because with this medication, it has 4 generations, and with this medication you're taking, it falls under the 1st generation, which can cause hypersensitivity.
Okay.
If you experience any allergic reaction, it can show itchiness, hives, swelling in your hands or feet, swelling in or tingling in your mouth or throat, chest tightness, trouble breathing, or diarrhea that may contain blood. Any unusual bleeding, bruising, or weakness that can also show if you have an adverse reaction. Additionally, you may experience decrease of appetite, so we would encourage you to stay hydrated with fluids and to have frequent small meals. That way you can also eliminate your nausea if you experience that. Be cautious to sun exposure, as some antibiotics can make you more sensitive to sunlight, so wear sunscreen and shades that can help you as well. Now, it's also important to note to when to contact your healthcare provider. If you experience any new onset of diarrhea, ringing in your ears, or if you missed a dose due to the fixed schedule, please contact us. That way we can get in touch with that to make sure everything's okay for you. If you have any questions or concerns, don't hesitate to reach out to us. The number provided that I handed to with the pamphlet, it's right here below.
Yes.
Do you have any questions before we finish?
No, I think that was it.
Okay, perfect.
Sounds good.
All right, I'll get your discharge process on with, okay?
Thank you, Miss Ariel.
You're welcome.